Society webinar, Mental Health in a Time of Crisis, Lessons from History and What to Expect. My name's Dr. Leslie Cannold. I work in mental health and I'm an author, an educator and a board member, including on the advisory panel of the AIS. I really want to welcome everyone here today to our conversation with Beyondblue's CEO, Georgie Harman. But before we kick off, I want to start by acknowledging the traditional custodians of all the lands of Australia and pay my respects to all present, past, and emerging leaders. This is and always has been Aboriginal land. I also want to encourage you to use the chat function at the bottom of the screen to ask questions. Please feel free to send these through at any time while Georgie and I are having a chat, and I'll either try to just integrate them into my conversation with her or ask them at the end. We're planning on keeping you for around half an hour to about 45 minutes, maybe a bit longer, depending on how long it goes, how many questions we get, how it all works out. But definitely you can know that I will get you out by about 10 to 1, so you can do whatever you need to do before you have to go back to work. So let's start. None of us have been untouched by the broad and sweeping impact of the coronavirus pandemic on our lives. From the first early days of worrying about infection and how to keep ourselves safe, to the catastrophically large and fast job losses, to the abrupt lockdowns that have severed us all from our usual routines, our learning institutions, our workplaces, and our loved ones, and the need to cope with change, absorb loss, and manage fear, it's all really been constant. For those with pre-existing mental vulnerability, the knockover may have come early, while for others, COVID-19 may be the first time they've had trouble coping. As each state in Australia takes its first halting steps out of lockdown, experts have begun warning of a second coronavirus curve, a curve of mental illness. We're still collecting data, but one preliminary study of Australians shows that 30% of us are reporting moderate to high levels of anxiety and depression. These same experts are warning that if we don't attack this second curve with the same resolve, resources, and commitment to evidence that we've shown with the first one, the result could be the loss of as many lives as have been claimed by the virus itself. So who better to help us understand where we are, what we know, and where we need to be heading than Georgie Harman? And Georgie's also really wanting to talk about how we do something which I think is so important, which is balance anxiety with hope. Georgie is the current CEO of Beyondblue. She has a long and illustrious career in health, including being the former Deputy CEO of the National Mental Health Commission and a current Director of Mental Health Australia, which is the national peak representing the mental health sector. So Georgie, thank you so much for being here to talk with me today.
It's a pleasure, Leslie. Hello, everyone.
Okay, so look, Georgie, just to situate us a little bit with you, I wanted you to tell us a little bit about the experiences and qualifications that brought you to the position of being the CEO of Beyondblue, and basically what the driving passion is that gets you out of bed every day.
Wow, that's a big question. So I have no qualifications in mental health, which probably terrifies a lot of people potentially watching this. But what I do have is a deep and abiding passion for what I do and what the organisation that I have the privilege of leading does every day. I fell into mental health. I studied history and history of art at uni. I nearly became a big corporate lawyer. I probably would have had a much bigger house if I'd done that. But there was something that stopped me going into the law, and that was really a sense of social justice. I didn't want to make rich people richer. I wanted to actually do something and get paid for it that actually helped others, and that I could go to bed every night and sleep okay. So I fell into mental health about 10, 11 years ago, quite by accident. I am a recovering public servant. I was in Canberra as a senior executive in the Department of Health there. And I was given a new job, and that was to manage national policy and programs and investment in mental health and suicide prevention and a whole range of other areas as well. And I thought, this will be interesting. It's an area of social policy that I've never really got my teeth stuck into. And I thought, I'll give this a go. And I had very kind of, to be frank, quite old-fashioned views about mental health and, people's experience of them. I really didn't know very much. And one of the first meetings I organised was with a group of consumers and carers, so people with lived experience and who support others who live with mental health challenges. And they absolutely wiped the floor with me. And they put me straight, and they told me about what their lives felt like, what their experiences were. And what I saw was a group of people who were just like us, who had the same ambitions, the same hopes, the same dreams, but were actually being horribly let down by the system. And that has driven me ever since. I've got a quiet rage, I call it, for the kind of injustice that still exists. There is some great things happening, and we have made strides forward. We've shifted stigma magnificently over the last couple of decades, but we from a system and a support perspective, we still have some way to go. So
Yeah.
that's what drives me. That's what gets me out of bed every morning. And working for an organisation like Beyondblue, it's a privilege.
So tell us a bit about this other coronavirus. So in the last few days, I suppose as we have been getting better news, we're not out of the woods yet, but much better news about how we're managing the physical threat that has been posed by coronavirus. We've really started to hear more about this other coronavirus curve. So tell us a little bit about what it is and whether you've been seeing it the whole time at Beyond Blue or you're starting to see more of it. Talk us through that.
Yeah, sure. So what this other curve is, so it's the mental health curve, it's the well-being curve. And we know that the links between financial stress, job insecurity, low income, disconnection, loneliness, isolation, family stress, all of these are major risk factors for poor mental health. And of course, we're experiencing all of these things at scale and at speed. So of course we're really worried about it. We've been worried about it for a long time, ever since this pandemic sort of hit our shores. And we've been working very hard behind the scenes to not only prepare our services and supports to adjust and to always be there, but actually to advise government and to really advocate for some of the creativity that we've started to see, some of the innovation that we've started to see, and some of the shifts in practice that we've started to see, that those should be long term. Because this is our moment for genuine structural mental health reform.
Right,
What we're seeing at Beyond Blue is, we saw it almost immediately. We were predicting about a 30% increase in demand for our services, and we were predicting that to happen by June. That happened by May, early May.
right.
And in fact, now we're experiencing every day about a 40% increase on what we would normally see. And
And are you talking about visits to the website? Are you talking about calls? What are
yeah,
you?
we're talking about all across all of our support channels. So we're talking about, so we have obviously a helpline, we have web chat with counsellors, we have online forums, peer support forums, we have apps, we have a whole range of services and supports for people. And across the board, 42% increase. Compared to this time last year, almost a 60% increase.
Right. Okay.
Yeah, so it's big.
Right, it is big. So I guess we're often being told that coronavirus is this, novel. We call it the novel coronavirus, and it's a 1 in 100 year event. But, when I was talking to you before today, when we were preparing for this interview, you really impressed me by saying, we do actually know a lot about from history, from past crises, about what we are experiencing and are likely to experience. So take us through that. What do we know from history about what crisis does to our mental health?
Yeah, sure. So we know from past pandemics, and we know from past natural disasters, and we've had many of them in Australia, especially in recent times. I mean, we forget that the summer bushfires were only a few months ago. So the compounding effect of that on what we're going through now is quite serious. But we know from past pandemics that there will always be a spike. There will always be a spike and a surge in people whose mental health starts to struggle. Not all of us. The majority of us will actually experience increased stress, elevated anxiety, worry, fear, all that kind of stuff. But that will subside for most of us as life returns to whatever normal life is going to look like. But it depends on the study that you look at, between 20 and 35% of people will experience a mental health condition for the first time. And a lot of that is about the trauma of what people have gone through, and a lot of post-traumatic stress, that kind of thing. So those are the kind of numbers that we know from previous experiences. We also know what to do, though.
Okay.
We know that we have to elevate mental health and put it on an equal footing to our physical health and safety.
Okay.
We know that we've got to talk about this openly. And I think what I've seen, again, through all of our channels at Beyondblue, but more generally, is people are actually focusing more on their health and well-being than we perhaps have done previously.
That's really promising, isn't it? Because in the past, there's been a lot of stigma about talking about mental health, hasn't there?
Yeah, look, there has. So we've seen incredible numbers of newcomers to Beyondblue, and we in a typical year, about 11, actually nearly 12 million Australians connect with us and our services. So it's, again, we're pretty well known, and I call us the big blue door. Quite often we're the first place that people come to when they start to realise that something's not quite right. And we can, provide them with services then, and we can then refer them on to longer term support if that's what they need. But we've seen, so as an example, we have these online peer support forums. We've had over 400,000 engagements with those forums in the
Wow.
past few weeks.
And are these the specific ones? Because I've been to your site and you've got your kind of regular
Yeah.
offerings, and then you've got some COVID-19 specific ones.
Yeah. Look, it's interesting because all of our regular services are continuing, but I keep on saying to my team, we have a singular purpose now as an organisation, because this is affecting everyone, as you said in your opening. Our singular purpose at Beyondblue has to be to be there for the community and support their mental health and well-being, and to prevent suicide, not only right now and through the pandemic, but out the other side too, because the mental health tail of and the aftershocks will actually be quite significant when it comes to our mental well-being. So that's our singular purpose. So all of our normal services continue, but we've had to adapt them. We've had to adapt them for, physical distancing. The shock for us has actually not been as profound as for many other mental health organisations, because a lot of our services are delivered over the phone and online and digitally. So we've just had to make some adaptations. We were given $10 million by the federal government about 5 weeks ago to build rapidly build, and we built it in 7 days. My team did 2 months work in 7 days to build a dedicated coronavirus support service, and that's now up and running. We've seen it's a digital site, so it's coronavirus.beyondblue.org.au. If you jump on that, you will find a whole bunch of very practical advice and information: how to talk to your kids, how to support yourself if you've lost your job, how to talk to your team, how to, we cover alcohol use, we cover family violence, we cover a whole range of things that we know from what people are coming to us for, that they're interested in. So the digital side is a great wealth of information, and it can refer you off to other sites and more specialist advice.
Can you summarize? It's completely fascinating to me. Can you summarize for us kind of what the elements are of the specific coronavirus response that's different to the way in which you've been approaching, helping and supporting Australians with their mental health in the past?
It's to be frank, it's not that different. The basics are the same. We're delivering services slightly differently, as I said, but we already have a distributed workforce who all of our counsellors work across the country, or doing the live web chat mental health support online and over the phone, and most of them work from their homes. So, in terms of service delivery, it's the mode hasn't changed that much. What we've seen, though, is this kind of wave of people coming to us for the first time, kind of entering into our world and kind of going, wow, I never thought I'd be here, but here I am. And that is a good thing. I mean, of course the numbers are worrying, but it is a good thing. And the earlier people are reaching out for help and recognizing that their mental health is not good, and getting the support, getting the tips, getting the advice, getting the support, getting the longer term referrals, the better we will all be as a country, as communities, and as individuals and families. Just back to the forum. So when you get onto that website, there's all the digital content there, but then there's two other really important sources of support. This online peer-to-peer forums, 400,000 engagements with them since we stood up, and that's a really safe, moderated space where you can register and you can choose to post and engage really actively, or you can actually just sit and watch. But you join discussion forums online, and you see the most incredible peer support. We've had 130,000 newcomers to that forum out of that 400,000. And then there's the phone line as well. So you can get straight through to a trained mental health professional who can give you confidential counselling there and then, but then also refer you on once they've talked through what your issues are to more specialist services. So it's a kind of multi-channel approach. It's early days, but the numbers are still quite staggering.
And in terms of the tail that you mentioned the tail, and I just want to kind of flesh that out a little bit. What do you mean by the tail? I've read somewhere that you can expect after a crisis that the ongoing repercussions for people in regard to their mental health can last up to 5 years.
Yeah. Look, I think there's a couple of frames that we can look at this through. All of the factors that we are experiencing, the economic, what this is doing to the economy, the widespread job loss, the disconnection of people from friends and family, the disconnection of people from the places and spaces where they normally stay connected. God, I'm missing hugging people. I'm a hugger. Right?
Me too. I'm missing it as well. And I'm missing going to the gym. I'm missing going to yoga.
Yeah.
I'm missing going to work.
That's right. So all of the routines and places that give us that structure and as human beings, we are hardwired to crave that stability and routine. We don't cope well when we can't see what's coming down the pipeline. So all of those things have changed.
And how quickly it's
And
happened.
how
You
quickly and the
mentioned that.
scale, that's the difference with this thing, I think. So with all of those changes, we know that, and the things like the economic aftershocks and the social aftershocks and the grief that people will be feeling if they've lost loved ones, or they've had a really quite scary experience with the virus itself. All of these things will create aftershocks. And we also need to stay eternally vigilant, because as we're starting to take these tentative steps back towards easing restrictions, it's a very fragile situation. So we actually need to get into the mindset, I think, as a community, to expect that there will be further outbreaks and clusters. Hopefully they're contained to specific geographical areas or places. But there may be times in the next, few years where we actually need to put in place restrictions. And I think we actually need to start trying to process that psychologically. Every single economic response by governments and others is actually a mental health response as well. Every single way that we can keep kids connected to schooling and to education is a mental health response. Our mental health and well-being is actually going to be foundational to our recovery as a country from this pandemic. And that's what we're all talking to governments about.
And is what you mean by that is that, there's kind of two elements of response. There's the response after people start to feel bad and start to have trouble coping, or that's one element. And I don't mean to call that the ambulance at the bottom of the hill, because of course you want to intersect with people way before you get to that, but that's that part of the coping. But are you also talking about the things that cause problems with mental health? So as you said, dislocation from education, dislocation from jobs, that really what we need to be putting in place is all of these preventatives that stop that dislocation and problem in the first place.
Exactly. So one of the things that infuriates me about my industry is that we're always talking about services, doing things to people. If we can actually equip the community to keep chipping away at that stigma and discrimination, to be more confident about reaching out and not feeling ashamed about that, to be having proactive conversations, checking in with one another, staying connected, asking, are you okay, and being prepared for the answer to be no. If we can do all of those things, if we can equip our workplaces to have mental health strategies, if we can equip our schools and support our educators, both at early learning and primary and secondary school, to be supporting the mental health of their kids as well as their educational outcomes, and also looking after their own mental health. And these are all the areas that Beyondblue works in schools, in workplaces, in community. If we take that population approach, then that is the best investment we can make. And then we also need the service system to be coming in and supporting people when they need those services. But we shouldn't be waiting when someone is so profoundly unwell that they need a hospital bed, or they're
No,
thinking of suicide.
absolutely.
We
And I
should
guess,
be we should be having we talk about it as being stepped care. So if you think about it as a ladder, right down the bottom of the ladder, it's a whole community approach. We all are aware of our mental health, of the signs and symptoms, of the options that we've got, and we're not afraid to have those open conversations. We can self-manage our mental health. We can look after our mental health. As we start to struggle a little bit, you move up the ladder. And at the bottom of the ladder, there's what we call low intensity services. So, and that's an area again that Beyondblue is working in. We have a program called New Access, which actually trains up everyday people as mental health coaches. You don't need a doctor's referral. You can just jump on our website and get a referral. You can receive that support over 6 sessions for free in the comfort of your own home, by phone or online, and face-to-face if you prefer, and when everything allows that to happen. And then you move up the ladder to, community-based supports and beds. And then you move up the ladder to obviously the more acute end in hospitals. If we can get the whole system built properly and talking to each other, we can actually move people up and down that ladder depending on their needs. And that's what's not happening right now.
yeah, so let's talk a little bit more about that. So what do you, like, we've had the government just appoint Ruth Vines, who was the chief Victorian psychiatrist, to sort of sit as the deputy to the person who's managing the health of issues around coronavirus. That seems to me to be a really positive thing, to have a dedicated person. What kinds of other things, in addition to what the government's already done? There's been kind of funding for people to be doing telehealth in regard to mental health. So talk about what you think has been done that's really, really positive. Talk about what you think still needs to be coming through in terms of government support from the state and federal governments.
Well, the first thing I'd like to say is I think Australia has actually been an absolute global leader in recognising the mental health impacts of this pandemic. We were one of the first, if not the first country, to actually be talking about this, and for government to be investing in it. And that initial package that I think was over the Easter weekend, the days are kind of blurring into one at the moment, aren't they? That initial investment of $74 million did a whole range of things. But what it really focused on doing, those weeks ago, was to opening up the front end of the system. Really equipping helplines like ours to have greater capacity, because that's the big door in, right? So it really opened up that front door and built capacity. It had also then focused on some particularly vulnerable groups, Aboriginal and Torres Strait Islander Australians, and frontline healthcare workers and things like that. So it was a sort of a layered package.
And we've also got a question here which talks about vulnerability in the regional, rural.
Yeah, that's exactly right. And that's where that front end of the system, no matter where you live, you can pick up the phone. And I think that's a really important sort of first principle. Rural and remote, they constantly lose out when it comes to services, and that's why we need to get more creative. Our workforce distribution when it comes to mental health professionals is woeful. They all live in the leafy inner suburbs of the eastern states.
Right.
That's where our workforce is, right?
Right.
So we need to be having these conversations now. We need to be training up new workforces, peer workforces, these coaches that I was talking about that can work alongside more traditional mental health professionals, but actually open up, more choices for people and easily accessible choices for people that are affordable and they're waiting for them.
Because not everybody does want to connect in this way via like Zoom.
No,
That
no,
works for
that's
some
right.
people, but not for everybody.
Absolutely. And I'm not saying that digital mental health services are, the silver bullet. But they are really a big part of the future and a big part of the solution. They don't replace face-to-face, but the reality is right now we have to do this, and this is better than nothing.
Mm.
So we and I think now there's been over 1 million mental health Medicare sessions. So we've done, I think when the expansion of telehealth and the national rollout of telehealth options for people was announced, we had been asking for that to happen as a sector for years.
It's amazing how many
And a
things suddenly
decade's
happened.
worth of work was done in 10 days.
Unreal.
So
Yeah.
that is the kind of thing we need to learn from, and we shouldn't return to the same old, same old.
Right.
We should be looking forward to the future where mental health support is delivered through a hybrid of face-to-face, digital, online, phone. That suits what people want.
Right.
That's what people are telling Beyondblue.
Right.
They don't necessarily want to go to sit in someone's office, once a week or once a month. They want options. They want homework. They want places and spaces that they can go to outside of those great normal appointments. But we've got waiting lists. We need to get creative about how we do this. And I think this pandemic, none of us would want to go through this again. None of us wanted this to happen. But by goodness, it is shown that we can do it, and we can do it at speed. And we're not always going to get it right, but speed trumps perfection at times like this.
That's right. And you never waste a good crisis. And so what you're
Always.
talking about is taking advantage of it. And
That's
it
right.
seems to me also that there's a need for real evidence base and modeling in the same way that we did with the physical health response, because there's been some very interesting modeling from the Brain and Mind Center at University of Sydney that really talks about how you can look at evidence-based interventions that you would think are the obvious thing to do, raising awareness in the community, raising awareness amongst GPs. But sometimes if you model that, you can see that it can have an uptick in regard to suicide, for instance, because the rest of the system isn't in place to respond to the increased help-seeking behavior that you want and the referrals that you want, and then people become disillusioned and disengaged from the system. So we really do need to be looking at this from a very hard-edged, evidence-based approach, don't we?
Absolutely. But we also need to be looking at it from a systems perspective. So it goes back to what we were talking about just earlier. Every part of the system needs to be working together and actually understand its place. Not everybody needs a psychology session. Many people do. But in fact, for many people, they can self-manage very effectively with coaches, with support from one another, with using apps and digital tools. Not every, but the way the system is built right now is you have one channel, and that channel is generally to go to your GP to get a mental health treatment plan, and then to have 6 sessions or up to 10 sessions with a psychologist or a psychiatrist. And that's a very binary choice. There are a whole range of options that are incredibly evidence-based that could sit alongside that and create greater options for GPs, for example, to refer people to. But obviously making sure those people who do need that more specialized care and professional support get it as well.
Absolutely.
The Productivity Commission, we're a sector that has had a sort of national investigation or review about once every 18 months, I think, in the last decade. So we've been reviewed to death. And the answers are usually the same. The Productivity Commission is looking
and the
at
reports stack up.
That's right. The Productivity Commission is actually looking at mental health right now, and Stephen King and his team is due to provide their final report to the Commonwealth Government at the end of this month, actually. There's a Royal Commission in Victoria, which is doing fantastic work. So we've got those two sort of structures, and then we've got this pandemic. If we can't work it out as a result of this, I think I will go and lie under my doona.
Don't. No lying under doonas. Get some help. We've got some really great questions that are coming through, because as you would know, this is really personal for a lot of people. The people who are listening to us, some of them may have had their own issues adjusting and constantly needing to readjust to the evolving situation, as you said, the kind of lockdown, the opening up, the potential to have to lock down again, work and everything just constantly changing, or they may know someone who's having difficulties. And one of the questions we've got is, how can you have that difficult conversation? Sometimes even with yourself about how you're going, but also with somebody else who you think might be having difficulty coping.
So let me tell you my story. So I am the CEO of Beyondblue. I am probably one of the most mental health literate people in Australia. And about 5 years ago, I had a whole series of terrible things happen in my personal life, which was centered around a relationship breakdown. I thought I'd met the person that I was going to spend the rest of my life with, and we broke up. And in hindsight, that was a good thing for both of us. But it just totally threw me. So what did I do? I didn't do the things that Georgie, Harman, CEO of Beyondblue, tells everyone else to do.
Interesting.
I
Yeah.
threw myself into work. I worked ridiculous hours because I didn't want to go home. I started drinking extremely heavily, and I was in a lot of trouble when it came to my alcohol consumption. I didn't talk to anyone. I just got up every day and went to work. And to be frank, it was work that kept me going. Work gave me a sense of purpose, and people were relying on me. So that was my. So I had a really bad depressive episode, and what happened to me was two people came to me at my worst point. And one of them was my deputy CEO, fantastic woman. And another was a really good friend. And they came to me within a few days of one another. And both of them said the same thing to me. They said, "We see you. We know what's going on. We love you. We want you to take a different path. What can we do to help you? Talk to us about what's going on for you." And that, because I am the CEO of Beyondblue, that was the kind of like, my reaction was immediate, like, oh God, that mask that I'd worked really hard to put on every single day obviously isn't working. So there's no point, might as well throw that aside. Start talking to people about what I'm actually going through and what I'm feeling. I went to see my GP. I had a few sessions with a psychologist. I went on antidepressants for a while. And I talked to my boss about it, and I said, this is what's going on for me. And as you would expect, my workplace was fantastic. They said to me, "Do you want to take some time off?" And I said, "No, I don't actually. The thing that's keeping me going but I might need a bit of, flexibility every now and then." So it started with a conversation. And I guess there's two things there. If it can happen to me, it can happen to anyone. And there is no shame in that. We would not feel shame if someone was diagnosed with cancer. This is a health condition.
Absolutely.
It's not a weakness of our personality. It doesn't mean that we're any less competent at our jobs. It is just something that all of us, and many of us, face. 3 million Australians live with depression or anxiety. This is a human condition, and it affects many of us. So having those conversations, I think, is really important. When you're worried about someone else and you know them and you love them and you care about them, you can see them going off the rails and withdrawing and talking about how worthless they are, and these are classic signs. Have that conversation. That is I'm urging everybody. Those conversations change lives and they save lives. So what is my advice to you? Jump on the coronavirus.beyondblue website. There is very practical advice about how you can set yourself up to have a good conversation. And thinking about the place and time that you have that conversation is really important. Are you going to get distracted? Is the person that you're talking to feeling safe and, kind of comfortable? And then you just open up in your own words. You don't need to get the words perfect. I'm really worried about you. These are the things that I've noticed. How are you feeling? I'm worried you're not coping. What can I do to help you? Should we jump on the Beyondblue website together? Should we make an appointment to go and see a GP? If it's about financial stress, let's call the National Debt Helpline together. Those are the conversations where everything starts. And then and be prepared for someone to go, no, bugger off. I'm absolutely fine. Keep going. Leave it there. Say, that's fine. I am going to come back to you in a few days or tomorrow, and I'm going to ask you the same question again because I'm worried about you.
Right. Okay.
And so be persistent.
Right.
Eventually, hopefully, that person will want to talk. And when they do start to talk, shut up. Just listen. Don't. It's against everything in our human nature. But try not
We
to
want to provide advice, don't we? We want
try
to.
not to jump to solutions. The most important thing at that moment is to listen.
Right.
And to then say things like, wow, that's incredible. Thank you so much for trusting me with that. Look, why don't we do these things?
Right.
And I'm there for you and whatever you need from me. So everything starts with a conversation.
Okay. I just want to remind everybody that there is a ability to ask questions. I'm getting a number of them through, and I'm going to put them to Georgie right now. But if you haven't had asked a question yet, please do. It's probably about time because we won't be talking for much longer. So, Georgie, one of our viewers has asked whether you are aware, or perhaps if you think there should be a change to the current government policy of only subsidising 10 sessions a year with a psychologist, the mental health plan limits.
Yeah, look, we're on the record. There was a big inquiry into this last year, and we're on the record. You can see our submission on our website, where we absolutely believe that there should be an increase in the number of sessions for people based on their needs.
Because the 10's pretty arbitrary, isn't it?
Yeah, and I think the Medicare system is fantastic in the sense that we were the first country in the world to offer that universal subsidized mental health support for people. But what we don't know is whether or not it's making people better because it's not measured and it's not reported. What we don't know is are people getting all of the sessions that they need, and do some only need 2 or 3 sessions, and do some need 20? So the number of sessions should actually be matched to your actual need, and that need should be reviewed regularly. And those outcomes, my view, is that those outcomes, your recovery, which can be clinically measured at every single point of contact, should be shared with you as the person, with your treating practitioner and the funder.
And surely you could also be collecting data about what is working.
Exactly.
Is it cognitive behavioral therapy? Is it more a psychoanalytic approach? Does it matter? Yeah,
because
all of that.
Everybody's what will work for me won't work for you.
Mm.
So our view is that yes, people should receive the requisite number of sessions under Medicare that suits their clinical need. But importantly, it shouldn't just be more of the same. And that's that we talked about this a little bit earlier. The Productivity Commission, in its first draft report, has estimated that about 450,000 people who are currently receiving that Medicare service could actually be better served with an earlier intervention and a lower intensity type service with different workforces. So if we can make sure that we match people's need to the service that they get, and we develop these new workforces and these new models of care where we measure outcomes and we report them so that everybody can see what's working and not, and we actually build all rungs of the ladder, that's nirvana. That's what we should be advocating for. So it's a long-winded answer. The short answer is yes, but matched to need, but not just that as the only option.
Yeah, no, it's not a long-winded answer because you were bringing back in a lot of the other things that we've been talking about, which is the importance of evidence. We really need to know what works and what doesn't work, and we really need to be adjusting to people's particular needs because nothing is one size fits all in this area, is it?
That's exactly right. And with our new access service, which again is coaches delivered online, over the phone, face to face where we can, with these trained coaches, and they have clinical supervision. We measure those outcomes and we share those outcomes at every single point of contact. And we've got about a 70% recovery rate, which is unbelievable, right? So these kind of models work. They're
Right.
actually more cost effective, and they're earlier intervention than a lot of the other options that we've got. And just through COVID, so we work with a number of service providers around the country. And with COVID, there was one of them that was having to close a residential rehab service for obvious reasons. And rather than lose or stand down those 15 very, very skilled staff, we're retraining them as new access coaches. And
Right.
we're going to be trialing a national telehealth version of new access
Right.
from June. So
Right.
that's the kind of innovation we need.
Yeah. Now, when you say recovery, what do you mean by recovery? When someone's recovered and they tell you they're recovered, what are they saying?
So you can look at it again from a clinical lens, or you can look at it from a personal lens. I prefer to look at it from a personal lens, but there are clinical measures and scores and tests, if you like, that when you sit down with your GP, they will ask you sort of, I think it's 10 to 12 questions, and they'll ask you to rate how you're feeling about certain things, how, whether or not you've got feelings of worthlessness, whether you're thinking about suicide, whether you're how you're sleeping, how your relationships are, those kinds of questions. Um, uh, and that will give them a score about your mental distress, your psychological distress. If you reach a clinical threshold where you're actually in the zones where actually clinically you could be depressed or anxious or have any, another condition, then, that's called caseness. It means that basically you're diagnostically able to, you've potentially got a diagnosis. But recovery is different and when we can measure, so with new access we measure using those tools people's recovery at every point of contact, and we can see the curve fall. We can see them move from caseness to actual where they've got symptoms that actually don't indicate they've got a clinical problem.
So
That's
you can still be on medication, you can
yeah,
still be having your interventions, but recovery is
absolutely.
when you
But
start
recovery
living
is
better.
about how well you function.
Right.
And that's what the way I like to think about recovery. It is so individual for every single one of us. I could be um, I could be, having 20 sessions a year with my psychiatrist. I could be on 3 medications, but I could be holding down a job. I could be, having successful relationships. I could have a good sense of self-worth. I could, like me, my experience with depression, it was temporary. It was about a life event. I did the necessary interventions at the time. I went on medication for a while and then I came off of it. And now I have self-management strategies that keep me well. And I know what to look out for in myself. So I am, I would say that I'm recovered.
Hmm.
But recovery is personal, and it's about your ability to function and to allow your mental health to actually thrive.
Whatever it takes.
Whatever
Whatever
it
it takes.
takes. It's going to be different for everyone.
So we've got a few more questions. A couple of them are about new access. People want to know, is the new access service for all age groups, and in particular whether they're providers that have skills for adolescents to manage adolescents.
Yeah, the beauty of new access is a great question. Thanks for asking it. The beauty of new access is the model is very adaptable. So, for example, with we're in 14 regions across the country at the moment, working with local service providers, and I think from memory, there are about 2 headspace services that have actually embedded new access into their model. So yes, it can be adapted for young people. It can also be adapted for elderly people. So we've got one provider that's running a new access program for for older Australians. We've got one service provider that's focusing on apprentices and young men in particular. So it's very adaptable. Um, uh, what I'd encourage your viewers and listeners to do is to jump on the website, beyondblue.org.au, and just Google and just search for new access, and it will come up with the contact details for all of the services that exist. Unfortunately, we don't have national coverage. We rely on services to be commissioned by government entities. So, and we're doing a lot of advocacy. But from the 1st of June, hopefully, fingers crossed, we will have a national service that will be available over the phone and online for anyone in Australia that can't access a local service.
And that
So the
is really
short answer
important.
to the questioner is not universally, but it is possible for young people, and that's what we're advocating for as part of our push for service reform.
And you just actually answered another question I think that a couple of people have had. So there's clearly a number of people here who are really struggling where they are to get services. So somebody has said, in my location, you go to the GP, you get your mental health plan, but then there's no one to see you after that. And someone else has said, pointed out that because mental health support workers are so scarce in regional and rural areas, they wonder whether doctors in those areas should have more of a say in developing mental health policy.
Yeah, look, those are two very, very good and questions that I get asked a lot, and I'm in furious agreement with both of them. We want a system where no matter where you live, you can get access to some kind of support. Sometimes you might need to wait a bit longer, but at the moment when we've got only one choice or two choices, and it's provider-led. Now, I'm not disrespecting psychiatrists and psychologists. They are fantastic professionals who work incredibly hard. But we have to develop new workforces because we know there is already a shortage of mental health professionals in Australia, and the distribution of them doesn't match where need is. So if we can develop the peer workforce, and the peer workforce is people who've got lived experience, they've been there, got the t-shirt, and they've come out the other end, and they can work alongside with people, actually offering that hope and recovery and connecting them to services. So the peer workforce is a massive untapped resource. Those low intensity coaches that again can be the step between, self-management and more intense professional support. These are the kinds of things that we want to and we should be again using modeling to match need to availability, so that in rural and remote Australia, we offer options for people that reflect their need, and that and a lot of the time, sometimes it will have to be delivered online, which I know is challenging for some people. And it is challenging from all kinds of perspectives in terms of, of the availability of data and reliable internet connections. But it's better than nothing. And I guess that's my point. We need to build up the bottom end, and redistribute everything so that people are actually have more choice.
Okay, this will be our last question, not because I don't have any more, but because I did promise to let people go. Georgie, you've been just a delight. You always are. So the last question is, somebody would like you to speak a little bit about how the services that you provide, and in general, the services that are available to people from culturally and linguistically diverse communities, and what the take-up rates are, if you're aware of them, of mental health services from people of those communities.
Yeah, look, thanks for the question. It's an area, look, so Beyondblue, we position ourselves as being there for everyone. But I need to be really clear, we are not a specialist service provider in this area. We can't be, we're not going to be. Our role is to actually advocate for better access for groups that actually have those trusted networks and relationships with CALD communities, with culturally and linguistically diverse communities. We can provide services for people, and we have all the usual translator services and all that kind of stuff. And we've actually worked, for example, in the Greater Dandenong region of Victoria, with a primary health network there to actually pilot a multicultural service there, which uses peer workers who've got really strong roots in their local communities, and we've had the thing evaluated its socks off. But that we then stepped away. We see our role as the kind of innovator and incubator, and the advocator for new models of care, and then we can poke and prod and get things running, and then we basically exit and say it's not our job. Like, the community itself and the specialist services need to take that up. We know that there are real challenges for culturally and linguistically diverse communities. Quite often the language isn't there. for things like depression and anxiety, there is huge stigma, social and structural stigma. So there are some real barriers to be overcome. There is a new national program called Embrace, which is managed by Mental Health Australia, which I'm on the board of. So again, embrace.org.au, and I encourage people to check that out, because it's got really, really good links to some of the stuff that's happening, some of the policy work that's going on, but also my understanding is the referral routes for people. So Embrace is, and it's a relatively new initiative. It was started last year. But, you know, just know that organisations like Beyondblue, we don't see our role as being the solution provider or the service provider, but we're absolutely in your corner. And we've got a big voice, and we advocate. But we'll never have the skills and expertise to deliver the kind of nuanced services that people need in those communities, and we accept that.
You know, Georgie, it's been just so good to speak to you. It's been so fantastic. Thank you, everyone, who's been part of this conversation and for sending in your questions. Georgie, thank you so much for answering them, and for answering my questions and sharing all your personal experience and what your service provides, and what we can both kind of anticipate, but also how we can respond effectively and beat this thing and come out the other end as a more cohesive community, and with many, many more of the services we need to see us through into the future. So you've been really terrific to talk to. I want to thank you so much for taking part in this conversation today. And before I sign off, I just want to let everybody else know who's listening that it is Ramadan. And for those who are interested in the AIS's virtual iftar program, please visit the Australian Intercultural website for further details about how you can take part. Our website is www.intercultural.org.au. And for now, we'll finish this conversation about mental health and wish everybody a beautiful day and great mental health going forward. Thanks very much.